Hello, my name is LaWanda Hopefields, and I have the honor and the privilege of serving as the director for the Ronald E. McNair Post-Baccalaureate Achievement Program, also known as McNair Scholars. During this 2019-20 academic year, we are excited to celebrate our anniversary of 25 years on the Wichita State campus. Although during this year, we have encountered many challenges, as most of America has, we are so proud to still celebrate our students, and we have great appreciation for the faculty members who have stayed the course to bring this year's scholarly activities to a close. I would like to acknowledge my boss and mentor, Ms. Delta Q. Colvin, for her support during these most recent challenging times, but also for her confidence in me to lead this dynamic group of students. Miss Ashley Cervantes and Miss Nisha Green are the capable hands behind the scene, and a mere thank you is not enough for all that they do. They are the backbone of our program, and I am forever grateful. As we celebrate 25 years of academic excellence and 15 students who are completing their scholarly research, I also want to thank you as our supporters and as our listeners. Thank you for being there for the students and for the program as we celebrate 25 years of academic excellence. Enjoy these dynamic presentations.
My name is Kyla Morris, and my mentor is Dr. Sharla Smith. The title of this study is an evaluation of Sisters and Brothers for Healthy Infants and collection of maternal voices. Black women are 3 to 4 times more likely to die from pregnancy-related complications. There is something about being Black in America over time, perhaps generations, that leads to worse birth outcomes for Black infants. Maternal mortality is the death of a woman while pregnant or within 42 days of the pregnancy. The United States holds one of the highest rates of maternal mortality in the industrialized world. The Kansas maternal mortality rate is 26.6 per 100,000 births. For white women, it is 22.6, but for Black women, the rate is 69.8, over 3 times that of whites. There are many factors contributing to why Black women are dying at a higher rate, including race, genetics, health status, income, education, and lifestyle, all resulting in chronic stress, poor quality of healthcare services, poor patient-provider interaction, racism, and discrimination. A woman's experiences throughout her life affects her health, more specifically the stressful situations. Black women report having chronic stress more than white women. Previous research also explains that medical providers' lack of cultural competency can negatively affect Black women because it can result in stigmatizing patient-provider interactions. These interactions place the mother and baby at risk because quality care is not being received. On top of these poor interactions, when Black women experience racial and discriminatory situations, it can cause chronic stress, further affecting the birth outcomes. Black people have endured slavery, the 3/5 compromise, where they only counted as 3/5 of a person, Jim Crow laws, and the injustices from police brutality and systemic racism. When this stress is internalized, women have a 4-fold greater risk of hypertension, which is simply abnormally high blood pressure. Black women develop hypertension earlier and more severely than white women, even though hypertensive disorders of pregnancy are the most preventable. To address this problem, Dr. Sharla Smith and Michelle Redmond created Sisters and Brothers for Healthy Infants in 2018. Comprised of Black Greek-lettered organizations, they aim to eliminate health disparities for Blacks in Kansas. Each fraternity and sorority provide a representative to attend each meeting and relay the information back to their chapter. SBHI hosts the annual Celebrate Day 366 event, which celebrates babies who have lived past 1 year. This event features free lunch, giveaways, education, resources, and a host of vendors. Some vendors that we've had over the past 3 years are March of Dimes, Healthy Babies, and the Wichita Area Breastfeeding Coalition. The initiative's new project is developing the Kansas Birth Equity Network. With this network, invested and trained healthcare professionals, policymakers, community stakeholders, and SBHI members will collaboratively work to develop a 5-year plan to bridge the gaps in care of Black women between communities, hospitals, and governmental systems. This study is a part of a larger study currently in progress focused on creating the Kansas Birth Equity Network. This study aims to 1, understand how experiences of bias, racism, mistreatment in care, and the community have impacted Black women's pregnancies, and 2, to determine the effectiveness of SBHI and the initiative's next steps. Black women will finally have a chance to share their stories and tell researchers what they need. This will allow researchers to tailor interventions to SBHI, the KBN, and to the community. Data was collected through two online surveys developed in REDCap. Both surveys were 30 questions and featured structured and unstructured questions. The surveys were advertised on the SBHI Facebook page and emailed to intended participants. The Maternal Voices survey asked about prenatal care, the birth, postpartum care, and birth equity, while the SBHI evaluation survey asked about the quality of the collaboration, Celebrate Day 366, their knowledge of maternal and infant health, as well as opinions of the future Birth Equity Network. All of the data was studied for common responses. There were 19 responses to the Maternal Voices survey. Women were asked about their number of pregnancies and live births, which varied from 1 to 7. One woman explained, "I overheard my doctor not knowing my name" when asked about her prenatal care. The next section asked about the birth experience. Some women reported positive outcomes with their babies and their treatment, but several women lost their babies or had to undergo unwanted C-sections. One woman said, "My baby and I were left in the hallway alone for an hour after the delivery." 8 women had postpartum depression. One woman said, "I lost my identity and I felt like a failure." When asked about birth equity and what the women could feel could be done to better support women and fathers, answers varied from more education about prenatal and postnatal care to more support. One woman said physicians should be more attentive and show investment in the well-being of the family. There were 11 responses to the SBHI evaluation. Fraternity and sorority members were asked about their thoughts of the SBHI collaboration. All responses were positive about the quality of the meetings. One member called SBHI an excellent collaboration and has benefits for the community. The next section asked of their thoughts of the annual Celebrate Day 366. Members mentioned needing to increase community attendance. One member stated that we are uniquely situated to address poor Black birth outcomes. Next, members were asked about their knowledge of maternal and infant health. Members were asked about the risk factors for pregnancy, which they correctly reported as high blood pressure, being over the age of 30, diabetes, obesity, and early-term pregnancy. Last, members were asked of their opinions of the future Birth Equity Network. Members believe that we should value integrity, ethics, honesty, teamwork, collaboration, and education. One member said we should develop a tangible intervention on each level, for example, implicit bias trainings for physicians or how to advocate when at the doctor. Both surveys had non-response errors. The REDCap system logs a response when the survey link is clicked, even if there is no data, forcing me to include those responses from the analysis. Also, some participants didn't answer every question in the surveys. Both surveys also had small sample sizes, but these are only preliminary results considering this study is still in progress. The Maternal Voices findings can be generalized to Black women across the United States of similar backgrounds. However, the SBHI evaluation can only be generalized to sorority members because there was only one male participant. This study provides a preliminary understanding of Black women's experiences. Every woman reported at least one instance of poor patient-provider interaction in their birth story. I also found that there is an increased need for education about prenatal and postnatal care. This study demonstrates a need for the Kansas Birth Equity Network, where a group of trained, diverse stakeholders, as well as 2 sets of parents from the community, will be educated on the determinants of Black maternal mortality. Then the network will develop a tailored intervention that eventually other states can replicate to provide resources, advocacy, and support to Black women, fathers, and babies. SBHI members strongly support this work but indicate a need for more participation of other fraternity and sorority members. Future research should employ a video campaign to further capture Black maternal voices in the community. We can also implement SBHI suggestions to the Kansas Birth Equity Network and obtain feedback from other fraternity and sorority members. Here are my references. Thank you for viewing this presentation. I think interviews would be more appropriate because it can be a conversation and it wouldn't just be a check of a box. They can really explain what they know and what they don't know, and we can be better prepared to help them. We will use this information when we tailor the intervention. So hearing that women need more support, meaning so we can find the resources and organizations that provide the support before the pregnancy, during the pregnancy, and after. This isn't a topic that we were researching, however, that it would be something that we can look into because insurance plays a huge role in the kind of treatment that Black women get. Thank you for viewing this presentation, an evaluation of Sisters and Brothers for Healthy Infants and collection of maternal voices. Have a great day.